Endometriosis is a disease that affects, it seems like every woman that comes to my office. However, in literature, they say about 30% of women. It is when the cells that are lining the inside of the uterus find their way outside of the uterus and land in the pelvis. And instead of those cells shedding every month when a woman has her period, they're trapped in the pelvis and cause inflammation and pelvic pain. There are different theories on what causes endometriosis. One of them is backwards blood flow through, from the uterus through the fallopian tubes that land in the pelvis, which is called retrograde menstruation. Some doctors don't believe in that because endometriosis has been found in distant places than the pelvis, like the diaphragm, like the lungs, sometimes the brain. So retrograde menstruation wouldn't really be an explanation for that. And it's been found in teenagers who haven't had their period yet. So there are other theories like flow through the blood vessels or the lymphatic system. So the primary or predominant cause, science doesn't really know the cause of endometriosis yet. Symptoms of endometriosis would be pelvic pain during menstrual flow. When a woman has her period, she has a lot of pelvic pain that may not get better with medications like ibuprofen, Tylenol, or even stronger opiate medications. So this cyclical pelvic pain, and eventually the disease can progress in such a way that it causes adhesions or abnormal connections between tissues in the pelvis and abdomen, where this pain can then be not cyclical, not every time she has her period, but then all the time, and she's always in pain. I would say in general gynecology, there's a number of treatments for endometriosis. The most common would be NSAIDs, so ibuprofen, meloxicam, other anti-inflammatory medications to try to manage pain. Some doctors will try medications that could be injections to try to suppress the endometriosis. But the best and ideal treatment for endometriosis is surgery to cut out all of the endometriosis lesions. And then I'm partial to the treatment that nephro-technology does, where we put all the good tissue back together to prevent pelvic pain in the future. If endometriosis is left untreated, women continue to have pelvic pain, which could be cyclical or it could be chronic, meaning it's all the time. And it can actually, in rare cases, it can cause bowel obstruction where they're not able to go to the bathroom if endometriosis involves the bowel. Can definitely interfere with a woman's ability to take care of herself or her family, or go to work, or go to school. So it affects the lives of a lot of women. Endometriosis is diagnosed surgically with a laparoscopy to directly visualize the endometriosis lesions in the pelvis. I would say after getting endometriosis removed, there are definitely some evidence-based supplements that women can take to try to prevent the recurrence of endometriosis. A low inflammatory diet is definitely good. Specific things that are inflammatory are gluten, dairy, and sugar, which are very delicious, but they can definitely increase inflammation in the body. So a lot of women who cut those out of their diet notice a difference. Endometriosis is associated with infertility. So a lot of women who have it notice that they have a longer time to achieving pregnancy or maintaining a pregnancy, because it can interact with hormone imbalance in the body. The diagnostic laparoscopy, which is a surgery to diagnose endometriosis, involves a surgery that's about 1 to 2 hours. You'd get a couple incisions in your belly button, and then depending on where your surgeon decides to place the other one, just to take a good look around the pelvis. You'd definitely be asleep the whole time for the surgery. At the end, you'd wake up tired, and then you'd probably get to go home the same day.